Hello, my name is Sean Burke. I am president of the River Valley Media Group and publisher of the La Crosse Tribune and Winona Daily News. On behalf of our company and all its dedicated employees, I would like to welcome you to our annual Nurses Week celebration and program. Now in its third year, our Nurses Celebration has quickly become a proud tradition. We are pleased to share these remarkable stories of nurses in our community. These are stories of dedication, empathy, compassion, and caring. They are stories of healing, recovery, and sometimes comfort and condolence. They are stories of the dedicated nurses in our community. As well, again this year's program takes on an only added relevance in light of the critically important work these nurses deliver helping our community through this difficult pandemic. Enduring incredible personal risk to themselves and their families, their dedication to helping others rises above all. Selecting our Nurse of the Year from among the myriad extraordinary contributions from our area nurses is quite difficult. The nominations are all inspiring. Here we celebrate and honor all of our community's nurses, and one in particular. I would like to personally recognize and thank our generous presenting sponsors, Viterbo University and Mayo Clinic Health Systems. As well, I would like to thank our supporting sponsors, including Minnesota State College Southeast, Winona Health, Benedictine Living Community in Winona, St. Mary's University of Minnesota, and Bethany St. Joseph's Corporation. Without the support of these generous institutions, none of this would be possible. As well, special thanks to our esteemed selection committee, including Tim Cotnor from State Bank Financial and Joanne Sandvik from the University of Wisconsin-La Crosse. Please join us in celebration of these remarkable nurses. From all of us at the La Crosse Tribune and Winona Daily News, thank you.
Hi, I'm Sarah Cook, and I have the privilege of serving as Vice President for Academics at Viterbo University. The university's dedication to training healthcare professionals continues to reflect the regional and national need for nurses. On behalf of all of us at Viterbo, I want to send a sincere thank you to all nurses in the Coulee region. The past year has been challenging in so many ways, but as nurses, you have proven and modeled your resiliency, compassion, and dedication to providing patient-centered care, no matter the circumstance. To the wonderful nurses serving our communities, including the thousands of nurses who are Viterbo alumni, thank you. We celebrate you during Nurses Week and always. As sponsors of this year's celebration, Viterbo University graciously thanks you as healthcare heroes. Thank you for caring for us.
Hi, I'm Jason Fresky, Chief Nursing Officer here in Southwest Wisconsin La Crosse, Mayo Clinic Health System. As Nursing Week commences, I wanted to take this opportunity to express my gratitude and recognize you for all the extraordinary work that you've done throughout the COVID-19 pandemic and beyond to serve our patients, communities, and each other. On behalf of Mayo Clinic Health System, our patients and communities, I wish to thank you for your perseverance, compassion, and exceptional care. We are proud of you leading our communities during the COVID-19 pandemic. You have undoubtedly made a significant impact on the lives of our patients and have done so with the highest level of compassion, professionalism, and grace. We're extremely grateful for you and all that you have done to provide extraordinary care to one of the most challenging times we have ever faced. Happy Nurses Week. We celebrate you and all of you've done for our patients. I'm honored and privileged to be a nurse and to work along with all of you. Thank you.
So I'm a nurse manager currently in the endoscopy department at the Mayo Clinic Health System in La Crosse. And what makes my position unique is we are an outpatient and an inpatient procedural area that does procedures in the GI tract. So colonoscopies and gastroscopies, just to name a few of the procedures that we do in our department. As always, we live in a pandemic. So what makes this year very unique is our department was closed down for a period of time during the pandemic. And then we had to implement rapid changes through our procedural schedule to start doing elective cases again. So I had to work with my staff of 28 to implement many changes that affected our practice. My reaction is I'm very humbled and very just appreciative of a member of this organization that has nominated me for this award.
Hi, my name is Caitlin Adams. I've been a nurse here at Gunderson for 5 years on the cardiopulmonary unit. My role here is to take care of patients and families, usually mostly with heart conditions and respiratory conditions. I get to work with the best staff in the world. They are the most supportive people that I've ever worked with. They're always there when I need help, whether I'm caught in another room, they're there to help me out to get the job done. During the pandemic, we all really came together and became a larger family here. We got to see each other more than we were getting to see people outside of work, so it really caused us to all kind of come together and get through those tough times and take care of the patients that were really, really ill that we were seeing. So we just became even more of a family than we already were. It's an honor that a patient took the time to recognize me through the La Crosse Tribune. It really shows that I am doing something right in my nursing practice along with all of my coworkers. And it's pretty cool that they took the time to do that. So.
Well, this year it's been especially unique. I'm the infectious diseases nurse at Mayo Clinic in La Crosse, and so I've had the opportunity to really get my hands dirty with the pandemic and COVID-19 patients in the testing center in the monoclonic antibody infusion center, working on the floor with patients that are positive, relieving people's fears over the phone, answering staff questions, provider questions, and basically anybody that is walking down the street that knows me, that I'm a nurse, that I can help reassure for questions. It's really amazing. I never thought that would ever happen, and it's very humbling. It's really something.
I actually, after I had my first child, I started at Winona Health 21 years ago, and I started in registration. At that time, I had gone into nursing, and I was doing registration in the ED. And so at that time, it was like, oh, yeah, I don't know if I want to be a nurse, because the only type of nursing I was seeing was ED, and I'm not real good. And I'm good in high stress situations, but I didn't think I would be, like, just too much nervousness. Anyways, it took me a while, but then I was moved around the hospital through registration in a couple different departments, and I was like, I want to do this. So then I went back and got my nurse's degree. Just taking care of people, I was working up in MSP on Med-Surg, and people are in the hospital, they're not feeling well, they're stressed, they're scared. Just doing little things, going above and beyond, doing their vitals, giving them their medicine, but spending time with them, talking with them, making them feel like an individual, listening to them, what they're scared of, finding that out. I don't know, it's a little different in the OR. Our patients are mainly sedated when I get them, or shortly after I get them, they're sedated. But in the OR, I'm the patient's advocate. It's if I see something that is not going well, or I need to stop, or, I'm their voice in the OR. So just being able to take care of them and making sure that if that was my grandma on the operating table, that I am doing everything that needs to be done. So sterility, they're taken care of, just making sure everything is there so that the operation goes as smoothly as possible and they have the best outcome.
Since I started in nursing, my focus has always been on critical care, and I have worked in the ICU here in La Crosse since 2014. So I enjoy working with people. That's why I went into this profession. I find that the most rewarding. My coworkers, by far, are some of the best nurses I've ever worked with. I miss being in the ICU every day with them. Some of the challenges would definitely have to be just chronic disease management, patients that come in and we can't necessarily fix what's ailing them. but just working with them and trying to get them to a point that they can have a quality of life. Very humbled, unexpected, and definitely humbled just because I work with an amazing team in the ICU, and without them, without that team, we wouldn't be who we are. So just very humbled that I can represent our ICU here in La Crosse.
At Bethany St. Joseph Care Center, what we do is skilled nursing care, and that's just a wide range of opportunities for nurses to expand their skills and their education. We do everything from complicated wound care to IVs to long-term care, memory care, and of course always infection control. The single biggest challenge we had was to help the residents adapt to their circumstances. We had to isolate them from their family, their friends. They didn't have free access to our building. And they had to look at us every day in gowns and gloves and shields. They couldn't even really communicate or see a smiling face. So that was the biggest challenge. How do we help the residents adapt to their circumstances? It makes my heart happy. I'm so excited. It's incredible to think that this family thought this much of me. And I think, a biggest part of my job is building relationships with residents and families and really actively listening to what they want us to do, what kind of care they want and how they want it. And it kind of reinforced for me that I'm doing a good job with that. I am listening and I hear what they say. I just want you to know that this being nominated is really a reflection on our whole team at BSJ. Without each other, we couldn't have survived this pandemic.
I work in child and adolescent psychiatry. We work with children and families to try to help with management and treatment of mental health diagnosis. Things I love about my job are the interactions that I have with the patients and their families, getting to know them and provide, personal, unique care for them. We really try hard to meet the patients where they're at and help them get better. I was really surprised and kind of overwhelmed with it. I know so many great nurses that are really deserving of this nomination, and it's been a really humbling experience.
Hi, my name's Adam Plowman. I'm a registered nurse at Gunderson Health System here. I've been a nurse for a little over a year, and I was on the cardiopulmonary unit, and also half my time was spent volunteering on the COVID unit. It was definitely an honor to be recognized by the Tribune and my peers to receive an award like this, but the credit really goes to my family for their support, goes to the Lord for giving me strength, it goes to my teams, physicians, namely Dr. Whitson, Dr. Fila, Dr. Hauskamp, and tons of PAs that we've been working with, but also the RNs that I work with, CNAs, dietary staff. It's all a huge team effort to really care for the patients and put them first. So the teams are what really deserves this award. Being able to work with other nurses from other units who normally don't work together, like Gen Med, Med Onc, all those different nurses, being part of that teamwork was so neat. It's a different world on the COVID unit, and just having all these nurses that don't work together come together and problem solve together, just helping hands everywhere. It was an honor to be a part of that, and it's indescribable. It's so neat, and I know every nurse that was down there reflects that and feels that. So it was a very neat experience during a challenging time. Patients being in the COVID unit, they have a lot of time by themselves. We can't have families visiting, so seeing the loneliness with the patients and seeing what they have to go through and just really being able to help provide them with an out, whether it's just talking or venting or being angry or crying or laughing, just really being there for them during those times was very rewarding. My best day as a nurse, knowing that one of my patients that I had right from the beginning, my first weekend on the floor of COVID, it was challenging to see that individual. He was on high flow oxygen, and then to find out that he went home. I didn't get a chance to say goodbye. It breaks my heart, but knowing that he's at home, looking out his bay window with the picture of his granddaughter there, like he was missing that, and knowing that he's at home, enjoying that now, that means the world to me. So very rewarding.
I am a registered nurse and an oncology certified nurse here at Mayo Clinic, and I am a nurse manager of the Cancer Center and Infusion Center. So I oversee nurses in both of those areas and make sure that patients really ultimately receive the best care possible that they can receive. Very humbled with that. There are so many deserving nurses, especially this past year with COVID. So many nurses that went well way and above and beyond of what their job entails, but it's what nursing is. It's their heart that's involved, and nursing isn't about the job, it's about the people, and again, the heart of nursing, which has to do with caring for people and helping them through whatever it is that they need help with. So COVID brought through many changes, and through the heart of that change was just making sure that we gave patients the care that they needed. And again, it's very humbling to be nominated for that. So many deserving nurses, especially this year.
Congratulations to Kathy Cermak, our Nurse of the Year in the Heart of Healthcare. Kathy is a registered nurse in the Cancer Center at Mayo Clinic Health System for the past 15 years. She said she's most comfortable being in the background, but today she's in the spotlight for the way she cares for patients and families. She says, taking care of patients is an honor and a privilege. If our patients are doing well, we rejoice with them, but we also grieve with them with their losses. Congratulations to Kathy Cermak.
I work in the Cancer Center, in the oncology department, where we take care of cancer patients. We give chemotherapy, we help assist with radiation, and we also work closely with the doctors to make sure that the care that is given our patients is well coordinated. Well, you know, our patients are so amazing. They have so many different things that they have to deal with, and then they get cancer, and so it's just one more thing. So, I mean, our patients are just awesome, and they become like family to us, and so it's not depressing because it's very neat to help them on this journey. Although some of the outcomes may not be what are necessarily what everyone would like in the big picture, we help them on their journey, whatever it may be. I was very shocked because I didn't go into nursing for any recognition or anything. I just wanted to take care of the patients, and you know, that's my main goal that has been for almost 37 years. So this, I mean, it's an honor. I'm very honored and very flabbergasted, I guess, because I was not expecting it, but it is very much an honor, and I'm very appreciative of whoever nominated me.